Hello, my name is Caitlin Berger, and my topic today is complex post-traumatic stress disorder, also known as CPTSD. First, I'll begin talking about who is most at risk. There has been no studies investigating the genetic predisposition for CPTSD. However, complex, long-lasting trauma is required for a diagnosis. One cannot simply be born with this disorder. Since CPTSD stems from trauma, those who experience abuse are at higher risk. This abuse can be sexual, emotional, or physical. Your risk is increased if you experience trauma at an early age, the trauma lasted for a long time, escape or rescue was unlikely or impossible, you experienced multiple traumas, or you were harmed by someone close to you. Since CPTSD has only been recently recognized, the role of epigenetics has not been specifically studied. Though, according to the European Journal of Psychotraumatology, DNA methylation and psychotherapy induce changes in certain symptoms. In patients with PTSD, interaction of the FKBP5 genetic variants and childhood abuse for PTSD vulnerability and symptom severity has been seen. Since many symptoms are shared between PTSD and CPTSD, this data is helpful as it provides a link between environments, specifically childhood trauma, and genes. There are also other risk factors associated with a greater risk of CPTSD, including gender. Women are more likely to be heavily impacted by CPTSD than men. This is because they're more likely to display the criteria required for diagnosis. Women are more vulnerable to sexual assault and childhood abuse, they're more likely to experience domestic violence, and they tend to react more emotionally to trauma. Those who experienced cumulative childhood trauma are more likely to have CPTSD than those who experienced cumulative adulthood trauma, though you can develop CPTSD as an adult. Sexual and physical abuse at the hands of a caregiver are also higher risk factors for CPTSD. Sexual assault by non-caregivers is associated with PTSD. There's also a connection between CPTSD and those raised in racially oppressive environments because they have higher rates of complex trauma. They are more likely to experience and witness racial violence, they're more likely to be in survival mode due to discrimination, and they're more likely to live in low-income environments with very limited community resources. So, what is CPTSD? CPTSD stands for Complex Post-Traumatic Stress Disorder. It is different from post-traumatic stress disorder, also known as PTSD. Like stated previously, CPTSD is a mental health condition that stems from ongoing trauma, usually during childhood. Symptoms include hyperarousal, also known as your fight or flight response, mood swings, depressive episodes, suicidal thoughts, difficulty maintaining relationships, negative self-view, difficulty sleeping, feeling ashamed or guilty, blaming themselves for their trauma, flashbacks, and nightmares. Short-term implications of this disorder on the individual include individuals becoming fixated on their abusers, either their relationship to one another or getting revenge. They may experience dissociation, such as depersonalization and derealization, in order to protect themselves from traumatic memories. Short-term community implications include those struggling with CPTSD are likely to avoid or fear relationships because they're hesitant to trust others. CPTSD can also cause relationship anxiety and relationship depression, creating animosity between those struggling with this disorder and their friends and family. Short-term, long-term implications for individuals are survivors in their adulthood often suffer with nightmares and flashbacks. They may also experience chronic pain caused by muscle tension, which results from constant states of hyperarousal. These hyperaroused states also affect your cortisol levels, which long-term can increase prolactin, causing higher pain sensitivity. Additionally, trauma during childhood can cause C-reactive protein levels to increase. This increases the risk of inflammation and autoimmune disease. And lastly, victims of abuse are more likely to be re-victimized because of their dulled alarm for danger. The long-term implication on the community is, as a result of trauma, adults may cope in dangerous ways, such as isolation, substance abuse, and despair. This can cause intergenerational cycles of trauma by exposing their children to their unhealthy coping mechanisms. Where is this taking place? This condition is not localized to any particular geographic area. Since CPTSD can originate from any type of long-term traumatic event, it does not affect specific regions. Examples of traumatic events that can cause CPTSD are emotional abuse, physical abuse, sexual abuse, witnessing abuse, slavery, trafficking, abandonment, neglect, and torture. When is this taking place? As of now, CPTSD is not recognized by the American Psychiatric Association in the Diagnostic and Statistical Manual of Mental Disorders 5th edition, also known as the DSM-5. However, the World Health Organization does acknowledge it as a disorder in their 11th revision of the International Classification of Diseases. Since the 11th revision was implemented on January 1, 2022, clinicians have officially begun diagnosing CPTSD. CPTSD is emerging and has a prevalence rate of 3.8% among adult men and women. Unfortunately, some clinicians remain hesitant to diagnose someone with this disorder until the DSM officially recognizes it. It is extremely important to note that CPTSD has always been a condition. However, it has only recently become recognized. Any type of long-term trauma can trigger this disorder. So, the point in time with the peak number of individuals affected is now. That is, individuals who were previously misdiagnosed or undiagnosed are now receiving the correct diagnosis. With this in mind, preventative measures can now be implemented to lower the prevalence of this disorder. Some disorders that CPTSD is often misdiagnosed as are borderline personality disorder, bipolar disorder, dissociative identity disorder, schizophrenia, depression, ADHD, and autism. The implications and projections of this disorder are also dependent on the COVID-19 pandemic and the increase of mass shootings. It is projected that the number of people diagnosed with CPTSD will grow rapidly because of the ICD-11 revision. However, the future of CPTSD depends heavily on whether the DSM-5 acknowledges it as a disorder. Recent protests urge that CPTSD is added to the DSM, and if successful, clinicians will no longer be hesitant to diagnose their patients with CPTSD based on its exclusion from the DSM. Patients will also have better access to treatment as some insurance companies require a DSM-5 diagnosis for reimbursement. It will encourage more research on CPTSD prevention and treatments, which will lead to more effective therapy options. Better treatments lower the chances of negative outcomes such as continuing the cycles of abuse, suicide, and self-harming behaviors like mutilation and drug abuse. If protests to add CPTSD to the DSM-5 are unsuccessful, patients under certain providers will continue to experience inaccurate diagnoses. This can be time-consuming and very confusing. They will also receive and pay for treatments that are unfit for their struggles, such as receiving improper medications and therapy methods. Though, we must consider the effects of COVID-19 and mass shootings on the population, as people are being exposed to more traumatic events for longer periods of time. As a result of the COVID-19 pandemic and the drastic lifestyle changes it brought onto the population, there's an increased risk of developing CPTSD. The CDC states that 44% of youth experienced persistent feelings of sadness and hopelessness during the pandemic. 55% of children experienced emotional abuse by their parent or caregiver. 29% reported that a parent or another adult in the home lost a job, and 11% reported experiencing physical abuse. A study also estimates that as of 2022, 8 million kids ages 18 and under lost a parent or a caregiver to a pandemic-related cause. We can obviously expect that this number is higher as of 2023. Stress, financial strain, grief, and increased rates of childhood trauma related to the pandemic will most certainly cause CPTSD rates to spike. Moreover, with the increasing threat of gun violence in this country, it is important to consider the long-term effects of this on American youth. More than 100,000 American children attended a school where a school shooting took place in 2018 and 2019. In 2023, there have already been 13 school shootings. As of May 12th, there have been 227 mass shootings in the United States. The long-term consequences of these shootings are increased rates of PTSD, anxiety disorder, major depression, and substance abuse. These disorders are risk factors associated with greater chances of developing complex post-traumatic stress disorder. What are the biological mechanisms needed for CPTSD to occur? To prevent complex post-traumatic stress disorder, mandated reporters need to become more aware of the warning signs of abuse in children and create better interventions when child protective services are involved. Communities also need to provide better and more safe spaces that offer support for kids and adults to disclose their trauma. CPTSD is controlled and managed with multiple different therapy options. The most common is cognitive behavioral therapy, also known as talk therapy. CBT requires the patient to work with a therapist to talk through their negative and inaccurate thoughts to create more effective responses and behaviors. Another very common method is medication therapy. The most common medications for those struggling with CPTSD are SSRI antidepressants, such as Prozac and Lexapro, or mood stabilizers, such as Lamictal. The last most common therapy method is dialectical behavioral therapy. This is another form of talk therapy that is used for emotional regulation by teaching people to accept their circumstances and prevent self-destructive behaviors. There are quite a few other conditions related to complex post-traumatic stress disorder. Like I said before, there is a higher risk for autoimmune diseases and chronic pain due to states of hyperarousal and muscle tension. But it is also associated with higher risk of amnesia, severe depression and anxiety, and dissociation. Childhood trauma is also related to a 13% increased risk of developing coronary heart disease, a 27% increased risk for chronic obstructive pulmonary disease, and a 33% increased risk for smoking, and a 24% increase for heavy drinking. So, why should we care about complex post-traumatic stress disorder? Well, the consequences can be dangerous and even life-threatening. People with CPTSD are more likely to suffer from substance abuse, suicide, and other health outcomes, as discussed on the previous slide. These issues are relevant to public health because substance abuse, heart disease, and suicide rates are growing concerns. Substance abuse is associated with a high risk of death, disease, including HIV and hepatitis, and risky behaviors. These risky behaviors include driving under the influence, theft, and selling sex. Moreover, suicide is permanent, and attempts can lead to unintended consequences, such as serious injuries, including broken bones, paralysis, brain injuries, and organ damage. We have now reached the end of my presentation. This is my works cited, including all of the sources that I got my information from. I would like to thank everybody who took the time to listen to my presentation, as this topic is very important to me.